follicular lymphoma patients have improving outcome, which nowadays come to the 20 years, the median overall survival. But still, there are some subgroup of patients who failed the treatment and whose outcome is really dismal. We are using the clinical prognostic indexes. So it's a FLIPI, FLIPI2, and there have been suggested some others. LISA group suggested or presented at the last ASH a new one, which is based on the population of the patients with follicular lymphoma treated within the PRIMA study, which was the study in which the patients, everybody was treated with the immunochemotherapy and then randomized to the rituximab maintenance versus observation. And they came up with a very simple prognostic index, which is based on the two parameters. It's a beta-2 microglobulin. If the patient has a beta-2 microglobulin higher, the level is higher than the 3 milligrams per liter, then the patient belongs to the high-risk group. If it is a normal level of the beta-2 microglobulin, but the patient has bone marrow involvement, it's intermediate risk. And if the patient has a normal beta-2 microglobulin level and no bone marrow involvement, it's a low risk. And in our cohort of patients, it was 1,179 patients who were treated with immunochemotherapy. We recapitulate these findings, and we have been shown that this index is really very simple, it's a robust, and probably it's a better and easier compared to the FLIPI indexes. But the main message of our talk was that in those patients who are usually considered to have a very good prognosis, it means there are those patients who are without progression within 2 years from the time when they started the therapy. Those patients have a very good outcome. But we have been shown that if we apply the PRIMA-PI index on these patients, we are able still show that the patients with the high risk groups have a 2.6 times higher risk to die compared to the patients with the low or intermediate risk. And these findings could have clinical consequences because the patients who are late relapses or late progressors, but they have a high PRIMA-PI index, they probably deserve more intensive treatment compared to the patient with the low or intermediate prognostic index. So this is our message.